Mental health should be a top priority even in the midst of a global pandemic and as we begin the holiday season and into the new year. Now, coming up on Polk Place, we will talk with the Florida Department of Health in Polk County about how they can help you. Make sure you stick around. Welcome to Polk Place. I'm Brian Lacey, and joining me in studio is Jenna Levine. She is a public health planning manager for the Florida Department of Health in Polk County. First timer, welcome to the show.
Good morning. Thanks for having me.
I want to talk to me a little bit, why is mental health so important to the residents and visitors of Polk County?
So mental health is a really important part of overall health. It's just as important as physical health, and it can have an impact on your physical health as well.
If you were to assess Polk County's mental health, what would it look like?
So we actually recently conducted a community health assessment where we did look at the mental health status of Polk County, and we found that it was the #1 top health priority that we needed to address in Polk County.
You had brought up a term, community health assessment. For those that might not know, what exactly is a community health assessment?
So a community health assessment is a process by which the Department of Health, together with community partners, collects and analyzes a bunch of data, different statistics, and also community opinion to try to determine what the most important health needs are for our community.
And what did that last assessment show?
So it showed that in Polk County we identified behavioral health, which includes mental health and substance use, to be the #1 most important priority that we need to work on in Polk County to improve our health.
I know that Florida Department of Health does a lot to combat this. What are some of the things that you guys do to help those in need?
So what we've done at the Department of Health is we do not provide mental health services, but we've partnered with our agencies that do across the county. And through Polk Vision, which is our community convening agency, we've come together and formed a behavioral health team. And all of our behavioral health providers across the county are on that team. That team actually just completed over the summer a more in-depth assessment specifically on behavioral health across the county. And now they're using the findings of that assessment to develop a countywide strategic plan to try to improve some of the gaps that we identified in the assessment.
The big question that I feel like that we have to ask everybody, whether it be Florida Department of Health, anybody that comes in, after this global pandemic, after COVID-19, what does it look like, and how has it impacted mental health within Polk County?
So when we actually identified behavioral health as the #1 priority, that was actually before the pandemic. And of course, the pandemic has exacerbated those issues for a lot of people.
I think a key word when it comes to mental health is stressor. What are some of the stressors that COVID-19 has brought on and that people should be aware of?
There's been a lot of loss. People have experienced a lot of loss with COVID-19, whether that's loss of life, loss of family members, illness, even loss of income and stability. People are struggling with food security. Our school children lost their sense of normalcy when they were pulled out of school. A lot of those children also lost their school meals. So there was just a lot of disruption, social isolation, just a lot of uncertainty that the pandemic has brought.
If there was something that you wanted the residents of Polk County to know, what would it be if you had to talk to them about mental health?
I would just want to say that there are resources out there that it is probably more common than people think about to experience struggles with mental health, and that there are resources out there and that you don't have to go through any of that alone. So I would encourage people to reach out to both local and national resources if needed.
one of those local resources. Talk to me a little bit about them.
Sure. So we have locally in Polk County, we have Peace River Center. They have a 24-hour mobile crisis line that you can call, and they will respond 24/7 and provide help, come to you and provide help. And that number is 863-519-3744.
And then there are also other numbers nationally. We have toll-free suicide lines. What are those numbers?
That's right. So we have a National Suicide Prevention Line. So that number is 1-800-273-TALK or 8255.
We've got just about a minute left. What I want you to do is inspire those at home to not push this down, to not sit on their feelings, to reach out and get the help. How would you do that?
Well, I would say first start with those that you trust, family or friend, someone that you know could help you get connected to the resources you need. And again, it's more common than we think, so there's no need to feel any shame or any stigma. This is something that we need to start talking about more as a community in order to make sure that people are able to get the resources they need.
Well, Jenny, you did a really good job. I want to thank you for coming in and providing all the information, and look forward to seeing you again.
Thank you so much.
Mental health was found to be a top health priority in Polk County. As a result, the Department of Health in Polk County partnered with Polk Vision and other community partners to create a behavioral health team. Now, the efforts of this team are being used to develop an action plan to improve behavioral health outcomes across the community. Experiencing mental health issues is common, and you don't have to go through it alone. You can seek help and build resilience. Now, if you experience a crisis, you can get immediate help by calling the National Suicide Prevention Lifeline. That number is 1-800-273-TALK. That's 8255 in English, or 1-888-628-9454 in Spanish. And locally, the number for Peace River Center is 863-519-3744.